Hello, I'm Dr. Alvarado. In response to the many questions I receive about laser refractive eye surgery, I've created this DVD presentation for your consideration. Many exciting advancements have been made in the last few years, and a staggering array of technologies and methods introduced. Today, I will review some of these advancements and how they influence results. Hopefully, this presentation will give you a better understanding of refractive surgery and perhaps answer some of the questions you might have. As I'm sure you know, not all surgeons and surgery are alike, and results vary accordingly. National statistics indicate the necessity to retreat a patient can range as high as 23%. My individual approach to laser refractive surgery is to stay abreast of all technical developments and adopt into my practice those tools and techniques that have been proven to truly improve outcomes. One such development of interest is the recent introduction of a new multifunctional instrument that allows me to shorten surgery time, avoid complications, and reduce the need for retreatment. This new technique, known as LAHayeSIK, combines the functions of several instruments into a single handpiece. The utility and automation of that one handpiece permits me to perform a cleaner, more standardized surgical procedure.
Although complications are rare, they can and do occur. The majority of complications and less than desired outcomes we see today include infectious keratitis, diffuse lamellar keratitis, epithelial ingrowth, decentered ablation, corneal haze, undercorrection and overcorrection. Most can be attributed to contamination by surgical debris, inconsistent hydration and dehydration, inconsistent laser effectiveness due to masking or blocking of the laser beam by moisture and surgical plume, inaccurate laser treatment because of uncontrolled eye movements, and other factors. Because of these issues, the need for additional surgery and subsequent treatments can range from 5% to 23%.
The LAHayeSIK instrument was specifically designed and developed to address these problems and reduce the need for subsequent retreatment. In a nutshell, I can perform multiple tasks with a single instrument, provide a barrier to intraoperative contamination, and perform a cleaner, faster, more consistent procedure.
The LAHayeSIK handpiece is applied to the patient's eye, where it remains throughout the procedure to provide the surgeon with fingertip control and delivery of 9+ essential surgical functions.
A particularly important function provided by using this specialized technology is the additional protection and enhanced sterile technique. The instrument's protective shape helps isolate the surgical field from contamination by fluids, eyelashes, and surgical drapes.
In conventional procedures, the surgical field is not isolated and protected, and the exposed tissues routinely comes in contact with pooling fluids, lashes, and other sources of possible contamination. When the surgeon positions the LAHayeSIK handpiece on the patient's eye, the outer cone design downsizes the surgical field and isolates it from contact with eyelashes, surgical draping, and other potential sources of contamination. The base also provides a gentle pressure on the small blood vessels around the cornea to minimize bleeding that can sometimes occur when a flap is made. In conventional operations, the surgical field is less contained and more problematic to manage. With procedures where a flap is made, a special non-metallic platform provides additional protection by anatomically supporting and protecting the delicate tissue from excessive hydration and contamination by pooling fluids. Once the target tissue has been opened, the next step is the laser ablation treatment to reshape the corneal stroma. Although the laser treatment is computer-driven, there are several important technical issues that must be consistently managed to ensure the laser accuracy. These include involuntary eye movements, laser beam masking by plume smoke, and hydration variability of the target tissue. Lasers have eye trackers to follow eye movement during surgery. However, no tracker is fast enough to keep up with the normal fast-searching eye movements which occur in conventional surgery. The positive control afforded by the LAHayeSIK handpiece assures that the fast eye movements do not occur during this critical ablation phase of the procedure. In addition, securing the eye protects the ablation area from inadvertent contact with lid margins and lid speculum. Surgical smoke created by the laser striking the target stroma is instantly removed from the surgical field by way of tiny evacuation ports located in the handpiece. This unique feature of the LAHayeSIK system removes the smoke right at its source, eliminating the smoke's vertical travel and subsequent interference with the accuracy and power of the laser beam. In conventional surgery, smoke abatement systems integrated into the various lasers are located several inches from the source, really too far away from the eye to be effective, and the resulting smoke can mask the laser beam, leading to uneven and inaccurate ablation complications that can necessitate retreatment. In addition, there is cellular fluid that accumulates across the surface of the target tissue during the surgery. This fluid, too, can alter the effectiveness of the laser beam. During ablation, the surgeon may wish to dry excessive moisture from the cornea stroma. Traditionally, surgeons may use sponges or instruments to wipe away that fluid. These traditional methods are difficult to standardize, can cause excessive and non-uniform areas of stromal dryness, roughness, and even result in small microabrasions leading to further possible complications. The surgeon's utilization of LAHayeSIK provides an exceptional method of removing excessive beam masking surface fluid by way of laminar oxygen aeration, delivered through 4 ports in the handpiece. There is no need to touch the eye with sponges or instruments, and the microfilter oxygen may provide additional benefits.
These intraoperative functions provided at my fingertips secure control of eye movement, proximal plume evacuation, and the microfiltered oxygen aeration synergistically help to ensure the accuracy and effectiveness of the laser treatment.
It often becomes necessary to irrigate the surgical field to properly rehydrate and cool the treated tissue and thoroughly wash away surgical debris. In conventional surgery, this is accomplished with a syringe or squeeze bottle of balanced salt solution. Excessive fluid pools and mixes in the recesses and depressions around the eye and eyelids until it is blotted away by the surgeon. These fluids and secretions can backwash across the highly absorbent ablation area and become trapped in the exposed tissues, resulting in complications.
The LAHayeSIK instrument helps me deliver pulsed, chilled, balanced saline solution to cool and rinse the treated corneal tissue without concern for backwash contamination. Excessive fluids are vacuumed away automatically, and I can control tissue hydration by using the filtered oxygen aeration feature. The use of fewer instruments, including abrasive surgical sponges to complete these tasks, reduces the potential of complications.
At the conclusion of the LASIK case, it is especially important that the corneal flap is closed and returned to its original position, with care being taken to avoid excessive manipulations, entrapment of debris, and the creation of wrinkles within the flap. In conventional surgery, flap repositioning entails using a variety of instruments, including forceps, spatulas, cannulae, and surgical sponges in an uncontained environment. By comparison, the protective flap pedestal within the LAHayeSIK handpiece allows the surgeon to replace the corneal flap in a single, simple movement, with very little manipulation required while maintaining fluid-tight isolation of the surgical field. Use of fewer instruments and less manipulation of the flap, while preventing fluid backwash and pooling, reduces the chance of vision-distorting complications. As you have been shown in laser refractive surgery, a multiplicity of functions are involved that require consistency, standardization, and strict adherence to sterile technique and important surgical principles. You have also been shown that laser surgery techniques can vary, further evident in the wide range of reported surgical outcomes and the varying need for retreatment surgeries. Although there are no guarantees in any surgical procedure, it is clear that advanced instrument design and associated newer surgical methods can facilitate the learned laser refractive surgeon in providing their patients with the best opportunity for improved results with lessened dependency on glasses and contact lenses.
I hope you have found this information to be useful. Please don't hesitate to contact our offices for additional information as you research this important topic. We are fortunate indeed to live in an exciting age of medical advances, and I will continue to keep a close eye on technological innovation with the goal of providing the very best care to my patients.